I have seen so many commercials on TV about pads, about Depends and women dancing around with, pulling up their pull-up so that for their leakage. And I'm here to tell you, you don't have to do that. You don't need to wear these pads. There are very good solutions for urinary incontinence, especially if you catch it early and before it gets really bad. A lot of times it can involve surgery, but it doesn't have to. If you get evaluated and you have a weak pelvic floor, then you can do pelvic floor strengthening, and a lot of times that will solve the problem. You can do Kegels exercises on your own. You can do pelvic floor muscle training or physical therapy where you have a coach to help you build up your pelvic floor. You can do the Imsella chair, which is just sit on it and it's going to do the exercises for you, the Kegels exercises for you. You're fully clothed, and it does it by electromagnetic energy that comes up through your clothes, through your body to the muscles, and you can feel the muscles contracting. So it really tones up your pelvic floor very quickly. And it's just as effective as doing the other pelvic floor PT or muscle training that involve probes and internal manipulation. So it's a very easy treatment for leakage. There are also surgeries that are fantastic for leakage that, are very effective. Very effective. We're talking like 95% plus surgeries. And I think in the past, like 20 years ago, we didn't have as many good options, and it just kind of got ingrained in people's brains that bladder lifts don't work because they knew somebody that it didn't work for. But I'm telling you that we have 20 years of data now on slings in particular. Very effective, very safe. I've done thousands of them. It's very reliable. Patients are typically very happy with it. And then there's a bulkamid procedure, which is going in with a scope and just tightening up the seal inside the urethra with some bulking. Similar to filler in lips, we put filler in the urethra, and it's 97% water, 3% hyaluronic acid. So it's just a very soft, like gel that's in the wall of the urethra. People, they don't feel it, they don't feel uncomfortable, it doesn't cause infections, nothing like that. Very easy solutions for leakage. Now that's all of those, or both of those surgeries are for what's called stress incontinence leakage, which is the leakage with cough and sneeze. The other kind of leakage is called urge incontinence, which is where you get home and you put your hand on the doorknob of the door in the garage, and it just starts coming out. And we actually have a term for that in urology called doorknob incontinence, because it's so common. It's kind of a trained reflex. Or you're washing dishes and it just starts to trickle out. That's called urge incontinence, and it's kind of like a bladder spasm. So the pelvic floor strengthening is good for that as well. The Imsella chair is good for that. The surgery may help that. It's not primarily designed for that, but 50% of the time we get lucky, and it does work for both. I don't typically do the surgery just for urge incontinence, but a lot of patients end up having both kinds of incontinence. So we'll do the surgery to treat the stress incontinence, and then sometimes we get lucky and it helps with the urge incontinence as well. But the treatments for the urge incontinence, we have so many treatments. We have all the treatments. Medication, some very good medications that are out. A little bladder pill you can take once a day to control your bladder. There is bladder Botox, which is actually covered by insurance, where twice a year you come in, we do a scope of your bladder and inject your bladder with Botox, and it helps the bladder to relax. There's a pacemaker for the bladder. that's inserted in the lower back buttock area. And there is a treatment that we can do on the nerve of the ankle. Believe it or not, there's a nerve right behind your internal ankle bone that connects to the bladder nerve. And we can do a treatment on that nerve, and it'll help retrain the bladder. So we've got several good options. You need to see a board-certified urologist or urogynecologist who knows how to diagnose you, is going to check for any other condition that could be causing incontinence. You should definitely have a pelvic exam. They should check you for a prolapse. They should check the condition of your vaginal walls, because if the vaginal walls are thinned out and weakened, then that's going to impact the bladder. And they should check for infection. They should check and make sure your bladder's emptying well. Do an exam to make sure there's not any kind of cancer. Very rare. I don't want anybody to get panicked or worried about that. Leakage is not a typical sign of cancer, but God forbid if I miss something like that. So I always do a pelvic exam to make sure that's not involved, and then running some tests to really evaluate the bladder further, depending on what your goals are and what you're interested in. If you're just interested in strengthening, you just need to be examined to see where you are right now. Make sure none of these serious conditions are going on. Check the strength of your pelvic floor, and then you can just start strengthening. Start the treatment, start the Emsella, start the pelvic floor physical therapy, whatever you feel like is more appealing to you. They're equally effective. But the bottom line is, ladies, that you do not need to live with leakage. You don't need to live with it. You don't need to live with pads. That gets really expensive over time. So go see a urologist, go see a urogynecologist. That is what we're all about. That's what we want to help patients with. And it's super satisfying to help someone not leak their bladder, because it's very impactful to people's lives. Treat it early and you'll avoid a lot of problems down the line, especially as you get really old. It'll improve your quality of life, keep you active, keep you moving, keep you traveling, keep you out of the nursing home, hopefully. Anyway, so much great technology, great treatments available so that we do not have to live with leakage.